Welcome to UMCC Medical Consultant Conators, where your health matters to us. Kindly like, subscribe, and share. Anti-cancer drugs or chemotherapy are key weapons against cancer's uncontrolled cell growth. They work by killing cancer cells or stopping them from multiplying, aiming to eliminate cancer, shrink tumors, or manage symptoms. Medical oncology is always advancing, offering new, more targeted therapies. Common drugs include cisplatin for testicular, ovarian, bladder, and lung cancers, paclitaxel for breast, ovarian, and lung cancers, and methotrexate for leukemia, lymphoma, and some autoimmune diseases. Each drug is chosen based on cancer type, stage, and patient health. Treatment is personalized, often a combination of drugs called combination chemotherapy, to attack cancer from multiple angles and prevent resistance. Regimens are carefully calculated to maximize cancer cell destruction while minimizing harm to healthy cells. In summary, anti-cancer drugs are a diverse, strategic cornerstone of cancer treatment. Understanding their basics is essential for anyone entering oncology. Let's explore how these drugs actually work. How do anti-cancer drugs stop cancer? They target the cell cycle, exploiting cancer cells' rapid division. Cytotoxic agents disrupt cell division at various stages. Alkylating agents like cisplatin damage DNA, preventing replication. Anti-metabolites such as methotrexate mimic DNA building blocks, jamming cell growth. Mitotic inhibitors like paclitaxel block mitosis by freezing microtubules, halting cell division. Targeted therapies are more precise, attacking specific proteins or mutations unique to cancer cells. For example, some drugs block growth signals on cancer cell surfaces. These targeted drugs often cause fewer side effects than traditional chemotherapy. The evolution of these mechanisms marks a major leap in cancer care. Next, let's see what happens to these drugs inside the body. Once administered, anti-cancer drugs undergo 4 key steps: absorption, distribution, metabolism, and excretion. Most are given intravenously for immediate effect, though some newer drugs are oral. After entering the bloodstream, drugs travel throughout the body to reach cancer cells. Barriers like the blood-brain barrier can limit access to certain areas. The liver metabolizes most drugs, sometimes activating or inactivating them. Kidneys, and less often bile, handle excretion. Drug clearance rates guide dosing to keep levels effective but safe. Doctors monitor kidney and liver function closely during treatment. Pharmacodynamics, what the drug does to the body, includes both killing cancer cells and causing side effects. The balance between drug levels and effects determines treatment success. Now, let's discuss drug interactions and side effects. Anti-cancer drugs can interact dangerously with other medications, supplements, or even foods. Some substances speed up or slow down drug metabolism, risking reduced effectiveness or toxic buildup. Grapefruit juice and St. John's wort are classic examples of problematic interactions. Always review a patient's full medication list before starting treatment. Chemotherapy often harms healthy, fast-dividing cells, causing hair loss, nausea, mouth sores, and bone marrow suppression. This can lead to anemia, infection risk, and bleeding. Some drugs may damage the heart or nerves or trigger severe allergic reactions. Close monitoring and patient education are vital to manage these risks. Let's finish with special considerations and key takeaways. Chemotherapy during pregnancy is highly risky, especially in the first trimester, due to the danger to the developing fetus. Treatment decisions require balancing the mother's health with fetal risks, often involving a multidisciplinary team. Sometimes therapy is delayed or adjusted, but urgent cases may require immediate action. Beyond pregnancy, patients on chemotherapy are vulnerable to infections due to low white blood cell counts. Precautions like hand washing and avoiding crowds are essential. Live vaccines are generally avoided during treatment. The psychological impact of cancer and its treatment also demands attention and support. In summary, anti-cancer drugs target rapidly dividing cells through various mechanisms, are processed by the body in complex ways, and carry significant risks and interactions. Their use in pregnancy is fraught with danger. As future doctors, mastering these principles is key to providing safe, effective, and compassionate cancer care.